Welcome back and many thanks for choosing Dissect TV as your channel of choice. And thank you so much for staying around with Kelvin while discussing what's happening around the political arena. But right about now, it's Let's Talk with Wairimu. And today we're going to talk about dental care, particularly on the mouth care. And I'm humbled to be joined by a gentleman who is a doctor or a dentist, and his name is Dr. Mugo. Karibu sana sana.
Morning, reviewer. I'm Dr. John Mugo, a dentist. Yeah.
So when we talk about mouth care, what exactly are we talking about?
Okay. When we start with mouth care, first of all, we start with about what do we have in our mouth. We have teeth, you have the gum, and you have the tongue. Those are the structures which normally are in the mouth. Most of the time, kuna vile wasastikatia kuangalia vile meno yako itakuwa mzuri ama mdomo yako itakuwa mzuri. Kuna vile una brush na itakuwa poa. Sana sana inatakikana kubrush meno asubuhi na jioni. Most of the time you normally say you brush 3 times per day. But mostly you are required to brush your teeth in the morning and afternoon. Yeah.
Not when going to sleep.
You see, maybe after eating. Yeah.
So when going to sleep, I can also brush.
Yeah, you can also brush.
How do I brush my teeth? Do I just brush up like I'm brushing my shoes or?
No. There's a procedure. First of all, you place your toothpaste on your brush. Then from there, there's a way on how you can brush your teeth. You have the front teeth and the sides. You normally brush like you are in a circular way, the side way. Then there's the top part, the opposite part. You can brush it to and fro. For because if for the side, if you brush like it is to and fro, you cause abrasion along the gum, and most of the time we normally have sensitivity. So that's why we normally advise our client you brush your teeth sideways, like in a circular way, but on top the occlusal surface, the top part, that is to and fro. Yeah. The front one is circular way. Yeah.
What about the gum?
The gum, even the gum.
We brush the gum with the
Yeah. You are supposed to brush your gum and also your tongue. Most people normally forget their gum and the tongue. Yeah. You have to brush your teeth, the tongue, those structures which are inside your mouth. All of them, you are supposed to brush them. Then from there is something people normally forget. After brushing, you are required to use your finger. You press a small bit of toothpaste. Unazugua kwa meno yako. But that one you will not rinse. You see in the component of you know one thing, toothpaste, there are those components which normally make toothpaste. One of them we have fluoride. Fluoride normally make our teeth strong. When you squeeze, you give time your teeth to dissolve that toothpaste. Yeah, it will help.
So I'm supposed to place the toothpaste on like anything?
Any finger, maybe the
forefinger.
The forefinger.
Then I smear the small.
Yeah, the small bit
on my gum.
on your gum.
For how long?
It will just stay there because the small bit. Yeah, it will stay there. You will not rinse it.
That is new to us. We just.
It is important, but most people, they normally brush, then they rinse, then that's all. You are required to a bit. You squeeze all over your gum. Yeah.
And when we are talking about brushing, what kinds of toothbrush do you use? How should
The toothbrush you are supposed to use medium, the one which can ile itatoshelea kwa mdomo yako, si kubwa ile. Then from there, the kind of toothbrush, you see, the bristles, we have different type of bristles, eh? Yes. Ile kadogo ukikaangalia kuna ile inakata hivi, iko curved. That's the best one. Kuna zingine zinakuwa kama V. That one is not good. Ukiangalia ile ka bristle kako curved hivi, that's the best one. Yeah. Then from there, it is not supposed to be hard or soft. Iko katikati. Hata ukikwarusa with your hand, a bit medium. Texture. Its texture is supposed to be medium. Yeah.
And how long do I use my toothbrush?
Then your toothbrush, you're supposed to use it after maybe 2 months or 3 months. You change. For because if you don't change, the texture of the bristles will just wear out. The texture itakuwa chini. And when you are brushing, haitakuwa inasaidia sana. Yeah, that's why we normally say it is good you change your toothbrush after every 3 months or 2 months. Yeah, that one you just dispose it. Yeah. Si kusema ati unapatia mtoto yako, it's not good. Yeah.
Now that you mentioned about kids, how do we take care of our child's mouth?
Okay. Kwa mtoto, unajua at age of 2 years, they normally have 20 teeth. Eh?
Yeah.
At the age of 2 years, you are supposed to train your child on how to brush their teeth. 2 years. They normally have their own brushes. And also, they normally have their own toothpaste. Kwa wale wadogo from 2 years to 5 years, we have little teeth. Its name is normally called little teeth. And it has age bracket, that is 2 years to 5 years. Then from 5 years to 11 or 13 years, big teeth. The toothpaste is normally written big teeth. Age bracket 5 years to 13 years. Then from there, still they are supposed to brush their teeth after every meal. Then, when placing the toothpaste on the toothbrush, it is not too much kama ya mtu mzima. Unaweka kidogo tu. Alafu, those toothpaste, they normally have a good taste. Even the smell. Even hata ukiambia sasa mtoto abrush meno, anatamani atatumia rini. Kwa maana iko a good taste, even the smell iko mzuri kabisa.
But does it mean siwezi mpatia toothpaste yangu ya mtu mzima?
Waweza tumia hiyo, lakini hata ukiangalia iko kali kidogo. Zona kwa mtoto sana si mzuri. Lakini ukikosa tu aweza tumia hiyo ya mtu mzima. But kwa watoto it is not good kutumia zile toothpaste with high fluoride. Wanatakana watumia ile iko na fluoride kidogo. Ndipo nikuelezea hivyo.
Na the mouth of an infant. Is there how do you clean the mouth of an infant? Kama wanakaa.
So an infant. Okay, an infant you normally use a cotton wool. Unaona kama an infant akona maybe maybe akona meno kama 4 ama 5, unatumia just warm salt water, a cotton wool, then from there unasugua tu, hiyo tu inaisha tu hivyo. Kale hakana meno, hiyo iko sawa tu, haina shida. So unajua sasa normally God created vile maumbile ya Mungu, it is natural. So unajua we normally have saliva in our mouth. Naturally it's there to clean, you see. Then from there kuna kitu moja nilikuwa nikuelezea about brushing. We normally say you brush your teeth after every meal. Yes. Na kulikuwa nimekuelezea you brush your teeth morning na jioni. But most of the time you normally get people brushing their teeth in the morning for because maybe kwa maana unaenda kazi. Alafu sasa unajua tu utapatana na watu wengine. It is very important to brush your teeth in the evening and brush. Kwa maana during the day when you are talking, your mouth normally produce a lot of saliva. So that saliva helps to clean the mouth. But usiku tuseme saa hii umekula boga, maybe sukuma. Alafu sasa asubuhi hiyo kitu utaipata kwa mdomo. Unaona? So it is very, unapatia wakati ya kula ile chakula. So that's why you get to decay. So it is very brush. Afadhali brush asubuhi, lakini kumbuke kabisa.
Now if we don't brush in the morning, our mouths will.
but for that one, it is very important. Yeah. And we normally say the rules. You brush your teeth after every meal.
After every meal.
But if you have to forget, but I forget other times, but not evening.
Are there effects of overbrushing? Because I know that
there are some effects. There are effects.
Because we said they brush.
It is not good to use a lot of force, as if kama ni kuna fita iko huko kwa mdomo. It is gentle, not a lot of force. For because if you use a lot of force, it will cause tooth abrasion. Tunajua we have the enamel, the crown iko covered na enamel, na root iko covered na cementum. Sasa there is a junction between the gum imefika. So if you overbrush, you utafanya iwe na recession, gum itaenda chini. Then from there itaanza sasa kuwa na abrasion pale kama kamtaro. Yeah. So it is not good to overbrush.
Wow.
Yeah.
Let's hold it.
Welcome back. This is the Morning Dew Show. Let's talk with Wairimu segment. And right about now, we are talking about dental care, particularly the mouth care. And before we went on break, speaking with Dr. Horo here, we were talking about proper brushing. And interestingly, there are people who will brush and have bad breath. So bad breath.
Dental caries, meno ambayo imechimbika. The other people, they can have calculus or tartar. Normally tartar, there are those people, when you're talking with them, you may see they have a certain layer on top of their teeth. You see, if you have that calculus, machine, it can cause breath. Then from there, you know one thing, mouth is one of the outlet of the stomach. Yeah, even that one, maybe probably, your work is, you are secret somewhere, you are not talking, you stay for a long time. By the time you start talking, maybe you hear a smell, but that one is not bad. But most of the time, the causes of bad breath is calculus, that's the dental caries.
Does what I eat affect the kind of breath that comes out of my mouth?
What you eat? No, not really. But mostly, you may hear maybe somebody who is taking alcohol in the morning. You see, that's maybe just come up.
Sure.
Yeah.
Now that I know you've talked about, let me call them holes.
Holes,
because I'm not a dentist.
Even holes are a good name for a layman.
Yes, because I'm not a dentist. Yeah. So how regularly should I maybe visit a dentist in case I notice my teeth are either cracking or such?
Mostly we normally say it is good you visit your dentist twice per year for checkup. For checkup. But most of the time we normally get our clients when they have pain or they have problem, or maybe alikuwa nakula anasikia sasa kuna mabo inakuja kwa mdomo. Sasa ndipo unapata most client wanaenda kwa daktari. But you are supposed to go to a dentist even if you don't have problem for checkup. When you come, tutajua kama kuna meno iko na shida, whether you are brushing your teeth well, maybe the other parts you are not reaching well, we will advise you. Yeah. That's why you normally say it is good you visit your dentist at least twice per year. But it's supposed to be regularly, if possible.
As much as possible.
But if it is not possible, twice per year. Yeah.
So for the people who do not maybe visit as it is required, what are some of the signs they could see and that would force them to visit, that would make it required for them to visit?
Most of the time, one of them is sensitivity in their teeth. Another one is maybe you may see maybe their gum, maybe when they are chewing, or maybe wakati anakula kama kitu kama miwa anapata ile manini maganda anatupa iko na stains. Unajua sasa at that time atafikiria ai nimekula kashida. So ataenda kwa dentist. The other one is pain. Yeah. Most of them they normally come because of pain. Yeah.
And when we talk about pain, kuna ule mtu atasikia uchungu wa ndiwe, nunua kijiti fulani, you chew, itakuwa sawa. What are the dangers of self-diagnosing?
You see, the dangers, when you maybe feel you have pain, then you say, I will just go and buy a Panadol or diclofenac. Iyo sasa ni kama you are making that problem to be worse. Not treating. Kwa maana wakati unasikia uchungu alafu sasa unaendelea unakunywa ka pain killer. So unajua ile shimo ilikuwa pale, hiyo pain killer haikumaliza hiyo shimo. So inaendelea kuchibika. Kama ilikuwa maybe ilikuwa imeanzia sensitivity na umechukua kadawa, hiyo sensitivity imeenda chini. By the time you realize your teeth are being destroyed, already the nerves imefikiwa. So ukikuja na kuelezea ile treatment nitakupatia, maybe is root canal ama sema nikwambie ni kungolewa. Na most of them wakikuja ukiwaambia the treatment ya root canal anasikia bei iko juu. So sasa at that time una lose your teeth or your tooth. So ni mzuri, it is not good ukisikia shida ati unaenda maybe kwa mganga ama unaenda kwa neighbor anasikia uchungu. It is good go to the dentist. Akuangalia meno yako ili ajue shida yako inatoka wapi.
Kuna kitu umemention about root canal, about kungoa and being expensive. So does it mean just because I have a hole kwa meno yangu si kama ningolewe ama what's the solution for feeling to?
Kikana kila kitu Mungu amekucreate na kila kitu, yani kila kitu wekea meno yako iwe inatolewa. Unaona? Kwa maana shida lazima zikuje. As long as kuna meno already iko na shimo, ukikuja inatakikana tunaitengeneza, si kungoa. So we have different types of treatment. If you have a tooth, maybe you may have a tooth which is aching, maybe it's a roots. Maybe those roots wazatolewa. But waweza kuja maybe iko na shimo, iko na pain, hiyo iko na pain inafanywa root canal treatment. It's an invasive treatment. Tunaingia pale ndani kwa pap chamber, unashiba hiyo kitu, unatoa zile nerves, kuna vile hiyo uchungu ulikuwa unasikia usiku inaisha. Maybe you may have a tooth which is decayed but it is sensitive. That which is sensitive but haijaingia sana, hiyo inafanywa.
Kuna vile unasema tunaingia tunachimbua and I'm feeling the pain already.
Si kuchimbua, si unajua sasa ni vile tu.
Lakini najiuliza how do you handle such a patient mwenye anajua nikienda kwa dentist that is sindano na uchungu? How do you handle such patients?
Most of the times unajua you normally treat our client the moment akiingia kwa mlango. Vile tu anakuja tu hivi, wewe unamwangalia tu. Unaona kama ako na uoga ama hana. Vile anakuja tu hivi, unamkaribisha majina yako, shida yako ni nini. maybe kama unaona kama akona uoga, waweza muulizia maswali mengine from apart from, then from there una ile report mzuri, then from there unamuulizia sasa shida yako ni nini. Sasa kama unaona uoga iko tu, mnaongea mpaka ana relax, then from there unamuulizia sasa hii jino yako ulikuwa unataka tufanye nini. Anakuambia mimi nataka tungoe, alafu from there unamwambia si lazima ingolewe. So then from there, if it is possible, unamweleza sasa hii tuweza ifanya filling. Then from there, mwishowe maybe kiwa anaogopa hiyo shindano, unamwambia hiyo shindano hakuna uchungu. It's just na inanga there is no pain.
Really?
For that one, for dental injections, they are not painful. As long as yule daktari anaweka hiyo dawa na anaiweka slowly. So unajua inaingia kwa nyama. Ikiweka unasikia just a slight prick. Kidogo tu. Then from there, so unajua this is anesthesia. Ikiingia tu kwa mdomo, hakuna kitu kingine. Sasa patient anauliza, hey, umeninuka kweli? Unamwambia hii ndio nilikuwa nayo. So then from there, ukicreate a good rapport to the client, hiyo uoga tu itaenda tu.
There's this patient watching us out there. Kuna mtu anatuangalia pale and anajiuliza, what do I need to check to know that I have gone to the correct dentist?
First of all, ni mzuri si kuangalia ile ulebesho tupate maybe ameweka mafitu kwa nini kwa wore. One of the things kuna zile barua zinawekwa kwa walls. Unapata maybe there is a certificate of registration. Then from there unaona certificate zake. That's one thing. Kutoka hapo kuna hiyo kitu ingine. Kuna ile maswali wewe unaulizia. Utajua tu kama huyu daktari ni daktari wa ukweli ama is just is a quack from nowhere. Lakini sasa ile ya barua, then from there unapata ameandika mzuri, then from there ile zile vitu utapata pale, unatajua tu hapo ni kwa daktari wa meno. Lakini barua inakuweka kwa walls. Yeah.
So it should be there always.
It is supposed to be there.
Hakuna huko singi.
Yeah, it's supposed to be there. Yeah.
I don't know if people have a problem with smiling. And especially maybe ukiwa na ile meno haiko ile straight sana. How do we fix that?
Okay, for that one about smiling, you see there are those people with malaligned teeth. Maybe akiwa mdogo, maybe wazazi wake hawakujua. So iko malaligned. Vile sasa hizo meno tunaweka braces. Una-align, kuna vile tunasi-align. Inakuwa smart. But it's a process. It will depend with the malformation. As a maliza 1 year or 2 years. But there's a treatment for those people with malaligned teeth. Then from there, you see, function ya meno, ni umeulizia about smiling, you are nini, the facial appearance. Then from there ni kutafuna nayo. Unapata sasa for the aesthetic purposes, unapata kuna wengine wametolewa meno. You see? Kuna vile sina replacewa, waweza wekwa, there is replacement ya meno. Waweza wekwa, tunasita dentures. Kuna partial dentures na kuna complete dentures. Kuna wale maybe wamepoteza meno yote. The whole jaw. Those one we normally replace them with complete dentures. And they are there. If ukiwekwa tu, unapata already amerudi vile alikuwa kitambo. Maybe umepoteza one to the, even that one it can be replaced with a denture. But there are others we normally call them crown and bridge, permanent. Hizo wawekwa tu, ziko tu. That one will depend with sasa vile wewe unataka na mfuko yako. But
let's talk about briefly about taking care of this crown teeth, or the one, especially those ones that have a gum they have to remove.
Okay.
Let's talk about that very briefly.
Okay. For those are partial dentures or complete dentures. Kuna vile, first of all, ukikula lazima unasitoa, unasafisha. Na vile unasafisha, you normally use a katamba, a cloth, and tunaona sabuni ya bar soap. kadogo tu unaweka vile unasafisha vyombo vyako. Unaosha tu mzuri, unaosha, alafu then from there you rinse. Then from there put them back to your mouth.
So they should not use normal toothbrush.
There is no need of using normal toothbrush. So unajua sasa kuna wengine wanatumia hiyo but a cloth with hiyo kasabuni inasaidia sana.
That is the requirement.
Yeah, then from there if you are not wearing, maybe kuna wao unapata wametoa. Lazima unaweka kwa, you place them in water. Yeah. Plain water.
The gum inakuja kuwekwa hivi.
Hiyo gum. So unajua hiyo unaosha sasa, unajua sasa when I'm saying about washing, ni whole hiyo meno na the gum. Unaiosha, kuna unajua sasa iko na machakula. Unaiosha tu, then from there itakuwa una rinse, then unarudisha kwa mdomo. If you are not wearing, place it in water. Yeah.
Tell us as you wind up.
Here in Murang'a, you can get me at Dr. Isrogo's clinic, Murang'a town. I have also a clinic at Kangari, Wakadi building, next to KCB. Yeah, Kangari town. Yeah.
Thank you so much for coming. I hope if I call you again, you'll come. It's such a wide topic. We cannot exhaust it all in one show. So that's it for the day. Our topic on Let's Talk with Wairimu was on dental care, particularly mouth care. And that's it. I'll be back in a